Hello everybody. Angel Ortega. Hello, how are you? Welcome and welcome to our live session. If this is your first time visiting the page, please hit the subscription button to the bell to get notifications anytime when we're live or when we post a new video. If it's your first time joining the live, again please hit the subscription button to the bell to get notifications anytime when we live or when we post a new video. Like the live if you just joined in the live session. Please hit the like button, share the share the link to your platforms. Let your friends, brothers, neighbors know that Mass Chef Cook is live. We're here to learn these amazing healthy lifestyle practices skills. Please like and share. Hit the like button if you just joining this live. Welcome everybody to our live session. It's Mersatab, your YouTuber. Welcome everybody. If you're just joining this live session, please hit the subscription button, to the bell to get notifications anytime when we live or when we post a new video. Like and share everybody. Again, if it's your first time visiting the page, please hit the subscription button. We gotta learn these healthy, amazing lifestyle practicing skills. We need this in order to maintain our health or improve our health. As I've always said in my videos, that life without health is insignificant. It means you're living a purposeless life. Your life has no value, has no sense of directions. And that goes with the saying that some people think we eat. That goes with the saying that some people think we live to eat. New Bido, welcome and welcome to our live, my buddy. Please hit the like, share the video, let your friends, brother, sister, uncle know that Mess Chef Cook is live. We're here to learn these amazing healthy lifestyle practices skills. There is always a saying that if you've never tried something, when you hit that milestone, 21, 22, 25 years, please don't even get it started, because when you test something that was not encouraging at a very youthful age, guys, the chances is for you to leave that practice and join our healthy lifestyle practices will be very, very minimal for you. Guys, hit the like, share the video, let your friends, brother, sister, uncle know that Mass Chef Cook is live. We're here to learn the amazing healthy lifestyle practices skills that we never knew. Oftentimes, they recommend us to get at least 6 to 8 hours of sleep in 24 hours. That's very important. It's not only meant for your body system to rest, but it also helps you to like think and reflect better after you get that good 8 to 9 hours of sleep. So it's highly recommended that sleeping that 6 to 8 hours of sleep is very important in order for us to stay healthy, mentally wise, and be productive in the society, because you can only be afloat in the society if you're able to think correctly and work correctly. Hit the like, guys. Hit the like button. Please hit the like button. Let your friends, brother, sister, uncle know that Mass Chef Cook is live. If you love your life, if you like your health, please avoid excess amount of sodium, excess amount of sugar, and avoid practicing addiction, because anything in excess is an addictive behavior that we are indulging ourselves into it. And once as you addicted to something, it takes quite a moment. It takes a toll on you for you to leave that practice. So always think about your health behind anything that you try to do for a daily life. I know it's not easy for us to leave certain practices that we've already, been in it, but we're here to help us quit our addictive behaviors. Hello, Auntie Every. Thank you. Welcome and welcome to everybody again. Let's get started. Please, if you're just joining the live, hit the like button. Please also remember to share the link to your platforms and let your friends, brother, sister, uncle know that Mass Chef Cook is live. Tell them it's a free session. Let them come grab the free healthy lifestyle practices skills they never knew. You know, life without health, as I've always said in my videos, is insignificant. We don't live to eat, but we eat to live. Because if we live to eat, it means we should not just care about whatever is getting ingested into our system. So we have to learn how to make nice food choices. We have to know how to stay away from high cholesterol food, high sodium food, high sugary food, excessive cold food, because too much cold food is not good for our intestines. It's not good for our internal body organs. So we have to put that at the back of our head, and we have to also learn not to start something that we've never tried past the age of 25. If you know you've never smoked, please don't even try it. It's a very poor and a toxic behavior. Not only does it kills you, but it kills your own immediate surroundings, and it kills the public. When you smoke in public in other countries, it's punishable even by fine. It's called public indecency. So we have to put that at the back of our head, because when you smoke, the smoke litters around, and people that are ingesting the nice free air, they also smelling that cigarette. And in the long run, if your neighbors, people in your community are smelling that all the time, they too are recognized as third class smokers, which in the long run, if they're not careful, their lungs also can be compromised. So you smokers out there, try to get some moral ethics when you smoke. Smoke in your basement. Smoke in a confined place, so that the smoke doesn't go ahead, go around and intoxicate the whole environment. Look for your comfort zone and practice your addictive behavior there alone. Don't get other peoples in the society involved, because not everybody is willing to go by your choices or your behaviors. Secondly, when we smoke, guys, we feel that we high. We taking it to feel very elated, but we don't really know the consequences behind that. Smoking in the long run thins our veins and our arteries, and that's the more reason why you see most of those smokers, they end up having high BP. When I talk of high BP, I means high blood pressure, because their veins and arteries have become too thin, that the amount of force, the amount of pressure that the blood volume needs in order to push the blood forward into other body organs, it's usually very high, and that's why they end up getting that high BP. Thirdly, smoking is a very deadly disease. You know, we can live better if we have that good amount of oxygen reaching every single part of our body. But if your lungs, that is the main exchange organ for fresh air into our system and toxic air out of our system, is compromised, it means you'll be retaining more of a dangerous gas, which is called CO2, carbon monoxide, very dangerous to our body. And once as you get more of that retained in our body, it means you're having now less oxygen, which your body cells and organs need in order to function correctly. And when that happens, you start getting shortness of breath. You start feeling fatigue. you start complaining of I cannot breathe, it's because you're retaining a lot of COPD, a lot of CO2 in your system than you're supposed to exert it, than you're supposed to like release it. So smoking is a very bad behavior. Thirdly, our lungs are as clear as a new silver pot. Our lungs are as clear as a new silver spoon. But when you drink, when you smoke, a lot of whatever you smoke, in the long run, your lungs turns to be that of a, black suit. If you know how black it is, your lungs will turn to be that of like a black suit. And once as it gets, to that level, they normally would diagnose you of a very terrible respiratory condition, which they call COPD, obstruct comp- COPD, which is compulsory obstructive pulmonary disease, which if you're not very careful, you can end up, having a lot of failure to do with your respiratory organs. So smoking is one of those behaviors that if you've never tried it, please don't even get yourself involved. And if you are practicing that behavior, please, I'm here to coach you. I'm here to take your hand to another level. I'm here to help you quit. You can start by talking to your doctor. Chantix has proven to be the number one treatment for curbing people with lung infections, from deterring people from smoking. So if you talk to your doctor can definitely provide you with Chantix, which you will use. And in the long run, if you were smoking 2 packets, 3 packets a day, you may end up smoking maybe just one or maybe a couple of sticks in a day. And gradually down the road, you will see how you're able to wean yourself. Another intervention that you can do is to get up when you know those moments are your smoking break times. Get up, go for a walk, 5 minutes, 10 minutes walk, or get a pencil, sit down. Could be a pen, a pencil, whatever, crayon. Just sit down and pretend that you're smoking that butt. And before you know it, that time will elapse and the craviness will reduce. You can decide and get into your blanket, tuck yourself very deeply into your blanket, and forget about what is out there or what you normally do. Before you know it, that craviness is gonna die off, and you eventually not, see yourself like you didn't get to like smoke during that your smoking time. Little by little, you can get yourself off that addictive problems. I know it's very hard, but bet me, you yourself, you have to be first of all self-disciplined in order to get this, out of your way. If you feel that this is the time for you to do it, then I'm here to coach you. Then I'm here to give you the tips that you need to like quit your addictive problems. So guys, like and share. And again, if you know that you always practice these addictive behaviors, this is the time for you to say no, because you digging yourself an early grave. Leave it. Don't practice it. Stay off it. If you know you've never tried alcohol, don't try it. I know they always say some doctors would prescribe, drinking for some people at least 6 ounces of glass of wine before they retire to bed. But again, that should be within your doctor's prescription. And that's usually done for those severe alcoholics, because you cannot just decide at one point and say, I'm gonna stop this behavior, because you may end up with a very, very big seizure that can even take your life. And that's the more reason why doctors would prescribe that you're able to take just 1 glass a day, and gradually they will see how they're able to wean you off. Alcohol is another very bad practice, as I'm saying, because we all know the disadvantages of drinking alcohol. Not only is it a triggering factor to high blood pressure, but also your liver. Your liver is very, very at stake. And remember, in somebody's liver is a very important organ in a normal functioning body. Your liver is like the powerhouse of metabolizing certain drugs or certain medications. So if your liver is gone and you eventually get diagnosed with certain ailments, it means you won't be able to even get therapy because your main organ that is supposed to break down medication and release the excessive chemicals that you need for your body is already worn out. So we have to be very careful with alcohol as well. It's something that if you've never tried it, don't try it. And if you want to do it, you can practice it occasionally. Meaning you can say it's only when I have an important event that I can try a glass of wine. And drinking wine is more preferable than even drinking the beer. So guys, be very careful when you're making your choices out there. Like and share, everybody. Thank you, Auntie Kirit. I'm glad to hear. Glad to hear you learning. Like and share, everybody. Like. All right. I think this is ready.